Hi, I'm René LaVoie, and this is the Tasteless Podcast. I am a senior student working on my Bachelor of Science degree in psychology at Arizona State University, and recorded this podcast on July 30th, 2022, as part of a research project for a really fascinating course called Sci 323, Sensation and Perception. Today, I will be discussing what I've learned after researching a sensory disorder called ageusia, so come along on this journey with me. Ageusia means a complete loss of the ability to taste and is one of the more commonly recognized symptoms indicating a COVID-19 infection in adults. Because COVID-19 has been so prevalent these past couple of years, you may know someone who has experienced a sudden inability to taste food while they were sick, or you may have experienced it yourself. As one can imagine, ageusia can have a huge negative impact on a person's day-to-day life. Scientists are working to better understand the mechanisms behind ageusia and develop safe and effective treatments for those who have lost their sense of taste. It is estimated that around 20% of people who have been infected with COVID experienced some change in or loss of their sense of taste. This might last the duration of the infection, more or less 10 days, or it may only last for a couple days out of the infection. But unfortunately, it can also last for much longer periods of time. Reportedly, about 20% of those people who do experience COVID-19 induced ageusia do not fully regain their sense of taste for several weeks or even months. This group is considered to have long COVID because their symptom of ageusia persisted after they no longer tested positive for SARS-CoV-2. Fortunately, the vast majority of people do recover their ability to taste, around 95%. So, what causes ageusia? First, we need to better understand how we are able to taste things in the first place. Our sense of taste, also known as gustation, is known as a chemosensation. We have skin cells that act as taste receptors inside of the taste buds on our tongue, as well as in our mouth and throat tissue. Our tongue alone has over 5,000 taste buds. When our saliva begins to dissolve the foods we eat, our taste receptors bind with those food molecules and release neurotransmitters, our body's chemical messengers. Different types of receptors bind to different chemicals in our food, communicating signals about sweetness, saltiness, sourness, bitterness, and umami. Nearby neurons or nerve cells then carry that information up to the brain for interpretation. The ability to taste not only allows us to find pleasure in a wide variety of flavors, but also serves as a method of survival because we have evolved to associate certain taste sensations like bitterness with potentially harmful chemicals. So why does COVID-19 sometimes cause ageusia? The answer is not completely clear, but scientists have some hypotheses. The first hypothesis is that an impairment in our sense of smell, known as olfaction, is affecting our ability to taste. Because these two senses function in such close proximity to each other, we tend to catch COVID-19 by breathing in respiratory droplets. Because the virus likes to hang out and replicate in our noses, our immune system can respond with inflammation, which means more blood flow to the infected area. This impacts our ability to smell. Likewise, when the inflammatory response occurs in our mouths, it can disrupt taste bud renewal, impacting our ability to taste. A second hypothesis is that SARS-CoV-2 directly infects our taste buds. Researchers have found that the virus can bind to the ACE2 receptors and compete with the sialic acid receptors inside of our taste buds. A third hypothesis is that the virus can affect our production of saliva, which may distort our sense of taste. And a fourth hypothesis is that the virus directly infects our oral epithelium cells, which lie under the surface of our skin and, together with our saliva, tend to be the mouth's first line of defense against viruses. So what kind of impact would a sudden loss of taste have on a person's quality of life? Well, no longer being able to taste your food can lead to reduced quality of life in a variety of ways, especially when experienced for a long period of time. Some negative physical and mental outcomes of ageusia documented by researchers were reduced enjoyment of food, reduced appetite, weight loss, depression, social isolation, eating disorders, ingestion of spoiled foods, and decreased enjoyment of life in general. So that's pretty grim. Can anything be done to treat ageusia from a COVID-19 infection? There is not yet a treatment specifically aimed at COVID-induced ageusia, but there are some treatments that doctors and scientists think look promising. These include intranasal applications of sodium citrate and vitamin A, olfactory training, and systemic use of omega-3 and zinc. Of all of these therapies, olfactory retraining is currently the frontrunner in research and in practice. It involves smelling specific scents, rose, cloves, lemon, and eucalyptus, for a certain amount of time each day, with the intention of helping the nerves involved in smell and taste remake connections via neuroplasticity. Research scientists are continuing to study the causes behind COVID-induced ageusia and are conducting clinical trials to find the safest and most effective treatments. What about prevention? Well, there isn't really any way to know whether or not you will experience ageusia during a COVID-19 infection, so the best way to prevent a potential loss of taste is to try to protect ourselves from getting infected in the first place. The CDC recommends getting fully vaccinated and boosted, wearing a well-fitting, high-quality mask like an N95 or a KN95, and limiting our time around crowds, especially indoors with limited airflow. As with any public health risk, we can take a layered approach, like in the Swiss cheese model. Imagine, if you will, a slice of Swiss cheese. It tends to have a couple of holes in it, right? Now pretend that slice of Swiss cheese represents vaccination. It is a pretty good way to prevent serious illness, but it isn't perfect. However, if we were to place several layers of Swiss cheese standing upright, it would be more difficult for something to get through those multiple imperfect barriers. So if we implement several preventative layers like vaccination, mask wearing, avoiding crowds, ventilation, testing, and practicing good hygiene, we limit our chances of catching COVID-19. So what can a person do if they test positive for COVID-19 and find that they can no longer taste their ginger tea or their chicken soup? If your sense of taste does not return after a day or two, you can discuss your concerns with your healthcare provider, and they can help you determine if a therapy like olfactory retraining is right for you. A valuable resource for olfactory retraining is the website AbScent.org. That's AbScent.org. It's run by a nonprofit group who provides support and information for patients working to recover their senses of smell and taste. As far as managing ageusia, it is important to make sure that you're eating nutritious foods as you regularly would, even though you cannot taste them. Let's summarize what we've learned today. Ageusia is the complete loss of one's sense of taste and is a common symptom of COVID-19 infection. Ageusia can have a major impact on a person's quality of life and can unfortunately lead to other serious negative physical and mental health outcomes like depression and eating disorders. Researchers are still trying to pinpoint the cause of COVID-19 induced ageusia and have several hypotheses, including damage to specific cells in our mouths. Doctors and scientists are also still working on determining the best treatment for ageusia and have found some success with olfactory retraining. The best way to prevent COVID-induced ageusia is to avoid getting a COVID infection through vaccination, masking, and avoiding crowds indoors. People who are infected with COVID-19 and find that their sense of taste is not returning should contact their healthcare provider for support. Thank you for learning alongside me today. I'm René LaVoie, and this is the Tasteless Podcast.